Hi everybody, it's Dr. Ansari. So now we're going to be talking about procedures for interstitial cystitis therapy. So please, if you haven't already, take a look at the other two treatment videos. There's one on initial therapies, then there's one on medical therapies, and this will follow with that as the last segment. Again, it's very important for you to make sure that you've talked to a physician about all of this because you need to first and foremost be diagnosed with interstitial cystitis, and then your doctor needs to create an individual plan with you because you may not be a candidate for everything that is mentioned in this video and in the other videos. It really depends on other medical problems that you have, as well as other things that may be required for you to try before you move on to advanced therapies. So the first thing that, one of the things that could be considered is something called hydrodistension. And this is basically stretching of the bladder. The idea here is that sometimes the bladder is so contracted down that it's in pain because it can't hold much. So you stretch it out and you stretch out those nerves so that it can hold more volume without stimulating or causing pain. Another therapy is called sacral nerve stimulation, or sacral nerve modulation is another term that's used for this. It's basically a bladder pacemaker used to target the urgency and frequency portions of the interstitial cystitis problem. It can help with the pain as well, but it's FDA approved for urgency and frequency. So this helps by targeting the nerves and calming down the nerves and then working backwards to decrease these two issues, the bladder symptoms of urgency and frequency. Another therapy is Botox to the bladder. So it's an injection that's done inside of the bladder, and that also helps with the calming of the nerves that trigger the bladder to contract and cause urgency frequency of the bladder. For more information on the sacral nerve stimulation and the bladder Botox, you can go to my set of videos on playlists under overactive bladder, and you go to the surgical options or the procedure options, and it goes more in depth into what these two are. We could alternatively also try PTNS, and this is also in that overactive bladder video, and this is an indirect way of calming the nerve down, so then it also helps with the urgency and frequency. PTNS is basically a needle that's placed at the level of the ankle, and it sends little impulses of electricity up the leg over to the bladder to calm down that nerve that's misfiring on the bladder. All three of these are FDA approved for urgency and frequency of the bladder. It's important to note that a lot of times treatments for interstitial cystitis are layered, meaning we're doing more than one therapy at the same time. Maybe you are on some pill medication that's helping a little bit, but then you need to move on to one of these advanced procedures. So you keep taking the pills in hopes that we can get further improvement, or maybe you're doing pelvic floor physical therapy, which has helped some, but not completely. Then we layer on other therapies. So just remember that it takes a lot of patience to go through all of this, and then a lot of trial and error. If we've gone through a lot of things within the practice and we can't really gain control over your situation, then we might send you to some of our colleagues for a more multidisciplinary approach, meaning for an approach that requires other types of doctors who do other things to help with the nerves and the pain. So one set of doctors that we utilize a lot are interventional radiologists, and they do procedures where they do nerve blocks and nerve ablations that can help with the activation of the nerves right here. We also work with pain management physicians who can also do certain types of blocks, but also put in nerve stimulators, again, to help ease the nerves and the pain that's felt with interstitial cystitis or painful bladder syndrome. So as you can see from reviewing all of the three videos on therapies, that the treatment for interstitial cystitis doesn't involve just one physician. It involves multiple types of physicians to gain control over this issue, because all different aspects of your body are involved, and we need to be able to treat multiple parts in order to have the best effect. Additionally, we may require you to see a gastroenterologist if you have issues with constipation or IBS, irritable bowel syndrome, where you go between constipation and diarrhea again and again. There's a lot of crossover between IBS and interstitial cystitis because of the nerves that are shared between the two. So it's going to be important to gain control over that as well. And we also may need you to see a gynecologist if you have other issues like endometriosis, for instance. Endometriosis, for instance, is a pain disorder, and it also contributes to inflammation, and so it doesn't help with the cycle that we're trying to break, along with other gynecologic conditions. And other times we might need to refer to urology for further therapy. Each person is different, each IC is different, and each treatment plan is different. And it takes a lot of time sometimes for us to understand what it takes to manage your condition, given that it's not curable. All right, thanks for watching, everyone.